Hello and welcome back for episode 33 of the Newbie Dentist podcast. I'm your host, Dr. Omid Azami. In this week's episode, I had the great pleasure of sitting down for a mentorship hour with Dr. Paresh Shah out of Winnipeg, Canada. It is always a uniquely great opportunity to have the chance to converse with and learn from a more senior clinician who not only has been in the profession for a long time, but has also excelled within it. Dr. Paresh Shah is a clinician in the truest sense of the word, and we had a great conversation about his career trajectory, going from dental school to a hospital residency into private practice and eventually into practice ownership. We dive into many topics on this one, including the value of structured continuing education programs, the benefits of becoming an excellent diagnostician, and general advice for new grads. I hope you guys enjoyed this hour of mentorship with Dr. Paresh Shah as much as I did. If you've been enjoying the Newbie Dentist podcast, please be sure to rate us on iTunes and leave a review, as it will help grow the community. If you have any feedback or questions or just want to reach out to me, please find me on Instagram at NewbieDentist. Without further ado, I hope you guys enjoy this episode with Dr. Paresh Shah.
Hello, and welcome to the Newbie Dentist podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here with Dr. Paresh Shah out of Winnipeg, Canada. Kindly agreed to sit down and share some of his advice with us today. You've had a long, great career, and it's exciting to have people like you on Instagram being so active. It's more of a younger community, so having someone of your experience kind of in there and mingling with us and giving us some pointers is special. So I do want to thank you for that. So when I have people like yourself on the show who have been around the block a few times, I really want to take that opportunity and just pick your brain as much as I can, more on the big picture kind of stuff. So what I'm hoping to do, obviously first we'll just go into your background a little bit. If you just give us a little kind of like an origin story of where you went to dental school and kind of what you've been up to, and then I kind of want to just get a little bit more in depth on a few things. So I'll let you kind of take that away for now, and then we'll hop back in.
Okay, sure. Well, thanks for having me. It's actually a lot of fun following you and a number of other younger dentists on Instagram and Facebook and social media, because it's actually kind of rejuvenated me a little bit. I was kind of pushing it aside for a while, but we can talk about that later. But it's just, my background. So I was born in India, but we moved when I was like 2 years old. So I've been living in Winnipeg for a very long time. My parents moved here. And so my dental school training and university, everything has been at the University of Manitoba right in Winnipeg. Yeah. So prior to dentistry, I kind of had a previous life. I was doing medical research, and I actually I finished a master's in physiology, and I was going to start a PhD. Oh, wow. And the funny thing is, my wife, who's in corporate finance and an accountant, and my father, who's a physician, they sat me down. Here I am in my mid-20s having this intervention and saying, "Hey, you shouldn't do a PhD. Why don't you go into dentistry?" And I'm like, "Dentistry? Why would I want to do that? I hate going to the dentist." Next thing you know, they're filling out my application, and a year later, I'm in dental school. So I've been a dentist for 27 years. I did a GPR in Winnipeg at the hospital, and then been in private practice. I've had my own practice since 1995. 3 full-time hygienists, myself, and I've had some part-time associates along the way. Yeah. It's been really a lot of fun. And then I did a bunch of continuing education. About 7-8 years out, I was getting a little bored, wasn't enjoying dentistry as much, and I got introduced to a group of people at the University of Minnesota in Buffalo that run a aesthetic continuum. And I took those programs, and then I actually mentored with them. And they were, at that time, I'm in my 30s, and they're in their late 40s. And I'm meeting these people, and I'm going like, oh my God, I've made a new set of friends. I've got mentors, and all of a sudden there's life beyond just, drilling teeth. And so I became very good friends with them. I mean, they're now in their 70s, and they just dabble in dentistry and enjoy life, but they're still inspiring. And then I started taking Carl Misch's courses, and then I I've done Coice, and I've done some Spear now, and it's just a journey. So that's kind of been what I've been doing. It's been a lot of fun. It's been a lot of fun.
That's great. There's a lot of things that you brought up that I'd written down that I wanted to actually specifically ask you. So we'll kind of dive into that a bit. So how I wanted to kind of frame this is a bit of a career arc, because I know, like myself, I'm about 2 years out now. I'm about like 18 months out. A lot of the listeners of the show are like dental students, or they've been out for 2-3 years. So I'm interested in asking you how that arc has been. So like the first couple of years versus like from graduating to year 3 versus like 3 to 10 plus. How has your mindset changed? How has dentistry changed for you? So if you can just touch on that a little bit, that'd be interesting to see what your perspective has been on it.
Okay. Honestly, when I first got out, you almost like, because I did a hospital program, I got a lot of confidence. Even though it was a lot of surgery, and some restorative, I got a lot of confidence in it, and so that helped me when I got into private practice. If you're a new grad or a young grad and you haven't had an opportunity to do, I mean, back then there weren't opportunities in Canada for like AEGD programs, right? Yeah. But if you don't do one of those residencies or fellowships, you need to have a mentor. My mentors were at the hospital when I did that, and then I worked at a practice here in the city with a guy that really I learned a lot just by listening to him talk to patients. So I learned how to communicate with him. But at that time, it's just you're trying to figure out what you like, what you don't like. And I think a good chunk of dentists are like that. Some just know, but a lot of us just didn't. And so you start working, and then all of a sudden, a couple of years out, I'm like, man, I still want to run my own practice. I want to own it. And there happened to be a sales rep that came and said, look, I got a practice that you might want. So I'd say the first couple of years is just finding yourself, figuring out what you're good at. And then as I get my practice, then you want to spend time trying to get to know the patients. You'd love to do everything. You'd love to do all of this fancy work, but I didn't know what I didn't know. Yeah. So all you're doing is just doing work. And then you see some more complicated bites and occlusions and things, and you go like, geez, I have no idea. So you just kind of ignore it and you just continue on, right?
Yeah, I can relate to that.
Then, right. And then I got kind of at the point where I was getting just not enjoying it as much. It just felt like mundane. I'm just drilling and filling teeth and pulling teeth out. And that's where I kind of got directed into some continuing ed. And I got out of my bubble here in my city. Yeah. And all of a sudden, as soon as you get out of there, you've had the opportunity to live in Toronto and in Melbourne. And so you see some differences, right?
For sure.
Well, I got out of my city, and all of a sudden you meet people and you realize, you know what? It's not necessarily different in that there's people from rural Minnesota and from Chicago and from LA and from, Spain and Greece. And we all have some similar issues, but we're also looking for something different. And as soon as you start gravitating to like-minded people who are wanting to just help each other get better, it's hard not to get caught up in that. Yeah. And so that's kind of the next stage after that was just finding mentors, which I didn't know that I needed them. Yeah. But all of a sudden I found mentors, and I found mentors out of my city. And then afterwards I came back and I started looking for mentors also within my city. And that's where everything started to blossom.
That's expanded. So when you graduated, 1 year of GPR in a hospital, how many years did you work as an associate prior to opening your practice?
3 years.
3 years.
3 years. I worked part-time while I was doing my my hospital residency. And then I started and I worked for about 3 years.
Okay. After. And so when you opened your practice, what was your scope of your clinical skill set? Were you kind of doing everything or?
Yeah, I was, because at the hospital I learned how to do IV sedations. I don't do it anymore. Yeah, but I did a ton of IV sedations. I did for the first 20 out of my 27 years. I did all of my impactions. I'd say 95% of them, even the hard ones, because I just learned from the best in our city. And so I was able to do that, and it kept me busy. And then you start learning how to do some restorative, and then all of a sudden you got to balance. Well, do you want to do everything? So I did that. I did endos. I was not very good at it. I don't do them anymore.
Yeah.
But you just did them because you were busy, and patients would go, "Oh, don't worry, doc, it'll be okay."
Yeah.
Crown and bridge. I got into some implants, but I had no mentorship for that earlier. And when I go back and look at some of my cases, some of them are great, and some of them are, I can roll my eyes and go like, "Oh man, it could have looked way better."
Yeah.
So I slowly, it was basically the initial one was just lots of restorative, endo, crown and bridge, lots of fillings and stuff.
Yeah. Were you doing any ortho or anything like that when you first opened up?
You know what? Not when I first opened up. And then I would say maybe, 15 years out, 12 to 15 years out, I started taking some weekend courses.
Yeah. Dabbled
in it. Did not enjoy it and didn't put my heart into it. So the work that the quality that I was doing, I got the end result, but it was taking longer for the patients to reach what I felt they should. So eventually I stopped.
Okay. So I'm curious because not so much in Canada, I would say. Maybe in the US, you hear these crazy stories of like dental students are like buying practices, or like straight out of school, people are buying practices. What do you think in terms of what should your like clinical arsenal be before you're like ready to like run a practice and have it be responsible and profitable? And because I even like right now, being a couple of years out, I do some like surgery, I do restorative, I do some endo. I don't do any implants yet or any ortho. So even now I'm like on the edge. I'm like, am I ready to offer like a complement of services to the patients, or am I doing a disservice by opening a practice? Tell me a little bit about what you think about that whole situation.
Well, we have the same thing here. There's a lot of young dentists, and some of them are just buying up practices literally to be able to sell it. And I'm not convinced that all of them are in it for necessarily the right reason. In terms of, I shouldn't say the right reason. They're in it for a different reason. And a lot of it doesn't mean that they can't do competent, good work, but their focus is the end game of trying to make a lot of money of selling, right? But let's go back to the ones that, genuinely want to practice and do well. There's no reason why you can't just start a practice or get a practice at your stage and run it, because I do believe that if your end goal is that you want to run your own practice, whether it's solo or with someone else, it's fine. I think the bigger picture is just understanding how you're going to go about doing it. If you're in heavy debt and your focus is like, okay, I'm going to do the practice, I'm going to buy it, or I'm going to build a new one, and then you get so stressed out that you have to produce that you start compromising quality or not recognizing that's where you can run into a problem. That's why I feel I think one of the best ways to do something is to actually find an existing practice you can buy and have some sort of a patient base. And then if you want to build a brand new practice from scratch after, you've got a patient base to work with. Because if you just open something up in a strip mall or somewhere else, like, it's expensive. I don't care where you are. You could be in Melbourne, you can be in Toronto, you can be in Winnipeg. It's expensive. And how do you pay for it? So if you can find an existing practice, even if it's a retiring dentist and you've got 400 or 500 patients, you have an opportunity. At least you have one opportunity to meet each patient once and make a connection. But are you ready? Yeah, I think you can be. I think it's a matter of how you approach it. If you want to be the jack of all trades and do everything, and you haven't been experienced enough to the things that work and don't work, you could get yourself into trouble. But if you find right mentors, take appropriate courses, and just proceed methodically, you can be successful. I believe you can.
And I think that's something that I'm like toying with that idea. I think it's tough because, like you said, the expenses are so high. So what I've been sort of thinking about and talking to some friends of mine who went to dental school with me here in Australia, potentially like opening up practice as a group. So that way
Right.
you split the cost. You can still maintain your like associateship elsewhere as well to have some income coming in.
Correct.
While you
Yeah.
grow the patient base. And I think to compete with all these corporate dental chains going around, that might be the future. Like kind of like the GPs have gone like with group practices. Something to like split the overhead a little bit so you can take that financial stress off so you can focus on the dentistry a little bit more.
Totally. And if you're doing it as a group, and you know what, I really do feel that the practice of the future is, and when I say future, it's not like 10 or 15 years from now, it's in the next few years. I do believe that is one way that we're going. I think there's going to be a lot of GPs that want to do all their work. I used to be one of those. I don't anymore because I realize the benefits of having some great specialists to work with. And I also feel that they benefit from my expertise as well. And so I can do things better with what I do. I'm not perfect. I do make mistakes, but I think collectively we work better that way. And I think your approach of, hey, maybe having a few friends and each of you have something on the side to at least make an income, gain some experience, but then kind of build that practice of your dreams. And then if there's some retiring dentists that you might want to bring into your fold and say, hey, you know what, if you're a couple of years out of practice, how about we buy your practice? You come and work with us. You don't have to worry about anything. And you can mentor us and then you can work. And then eventually you start taking over their patient base. I think that's a nice way to do it.
That's a great idea.
I really do. Not everyone's going to want to do that, but I wouldn't get all hung up. Oh my God, this doctor has a lot of old patients or this or that. Like, you know what? Patients are patients and all demographics are going to provide you with work, and they all are a little different. And, I've been ruling out, trying to attract millennials and Gen Xers. And all of a sudden I realized through my daughter and our friends and people like yourself that, you know what, if I want to practice longer, I've got to also connect with all you guys as well, not just, people my age.
Yeah.
Right.
That's great.
Yeah.
So another thing is, after I've seen, I forget the name of the charts, like with knowledge, your confidence kind of comes down because you start to realize all the stuff that you don't actually know.
Correct.
Because I feel like, for the first like 3 or 4 months of working, I was, obviously you're not as confident, and then you start to get some more successes and you short term, you're like, oh, okay, like that class 2 looks okay. My crown stayed on for a week, and then you get confident. And then, so I haven't been around long enough. And unfortunately I moved. So, they say success by like moving around and
by geographic success.
By geographic success. What was that like for you? Like that. So when you're in your practice, you've been there for, 5 years now, and some of the stuff that you did maybe in the early days starts to fail potentially. How was that experience like for you?
It's humbling, and you learn how to do it. And I think it's still an ongoing thing. I still see things because as I'm getting more experienced and older in my practice, I'm also doing more challenging work. And there are times where you run into snags, and I still see that sometimes. I truly, truly believe that the mark of a good clinician is someone who is humble enough to look into yourself first before anything else, before blaming materials, before blaming a team member. It's like look inside and go, what could I have done differently? What could I have done better? And also owning up to that. And sometimes it's just looking the patient in the eye and go, you know what? I don't know what's going on there. This should not be happening. I'm going to redo this. Yeah. And so it was tough initially. And now I just look at it as a learning process. You just want to minimize that. And you want to have way more successes than failures. But I just embrace it and just go, and I'm still hard on myself. Yeah. But I think as long as you have a conscience and you really care, those are going to be good things because they're going to be hallmarks of succeeding. That I truly believe that. For sure. And I think that's good. Yeah. It's something that affects me because I'll do something like I'll cement a crown and like the contact was light, and like that'll stick with me all weekend. Like I'm thinking about it, like when I'm eating breakfast the next day, and I'm like upset. So I think it's good. Like you learn more from failures than successes, I think, and that's always it's a good thing to do. Yeah, absolutely. You have to take both in stride. What bothers me is I've run into lots of dentists as I've traveled and lectured. And there's some that'll go, oh, why would you worry about it? Like, you can just redo it in a few years and insurance will cover it. And I just don't like that approach, because I want to build my practice on that. So I'm more like you.
Yeah,
it bothers me, but you got to stop beating yourself up, because you try, as long as you've tried your best and you've been honest with the patients, that's the best you can do. And if they come back and they're finding out for the next 6 months that they're getting all their food stuck between that contact, then you know what? Just redo it for them, bite the bullet, don't charge them, and have it as a life lesson.
For sure. Yeah, I think for me, like you said, I think reputation is more important to longevity than just trying to maximize income like all the time, like short term. Yeah, I think it's like doing the right thing will always win out, like over the long stretch. So you mentioned after about like 10 years or so, you kind of stepped out of Winnipeg and started attending some courses and got some good mentorship. Yeah, mentorship has been a pretty big theme, like in the podcast that I've done and everyone I speak to, because I think it's a really important thing. And I think sadly with how dentistry is kind of going today with more corporate, with multiple practice ownership, it's kind of, you lose that maybe mentorship. A lot of younger guys maybe don't have the right mentorship to learn and grow confidently. So once you went to these courses, how did that relationship continue? Did you send over cases every so often? Did you have like phone conversations? How did you maintain that mentorship to get the most out of it?
You're right, both. The people that started becoming mentors of mine, whenever we met, I would sit down and pick their brains about all sorts of things, tell them things that I was having issues with, where it was bonding, where there was sensitivity, my filling's not looking good, or how do I diagnose things, when I'm looking at a more complicated case, I'm on the right path. So I would take as much time as they would allow when I'm meeting them. And then I also had access to them through phone and through email. Yeah. So I'd be able to phone them and say, hey, I've got this. Now, the good ones will also ask a lot of hard questions, like not just give you an answer, but try and make you think, like, okay, well, what do you think the diagnosis is here? What do you think the real problem is here? And then did you look at this? Like, so they're not condescending. They're actually trying to make you think and be more complete. So that's one way. Nowadays, and that's what I had. And then I kept going back, because these people were just, and to this day, they're still very helpful to me. And so as you start finding courses or organizations that actually want to share rather than just suck everything dry from you, it becomes that much more enjoyable. Nowadays, there are all sorts of study clubs that are available. And some of them are really fantastic, and they're almost don't have a lot of conditions to them. And others, they do have some conditions, because sometimes they're based on referrals. Yeah. But it doesn't mean that it can't be good mentorship and camaraderie within those study clubs as well. Yeah.
Yeah. So what do you think, if you can just give some general advice to a young dentist working now a couple of years out, who wants to kind of expand? And I think that's something that I'm sort of learning now, because I got a good associateship where I have some good mentorship finally for the first time, where I have an older guy who's actually like teaching me like comprehensive dentistry a little bit better, taking pictures of everything. And then we'll go through cases together. And you're like, what do you think?
That's
like,
awesome.
Why is the wear on this side and not that side? Or why is this the lower end? So all that comprehensive sort of moving away from single tooth diagnosis to a more overall picture. What's your advice to that? How is the best way to, and I know you mentioned like doing courses that are like structured and curriculum, to shift away from like that single tooth, okay, patients come in with a broken cusp, let's just fix that, versus why is that happening, and address the overall picture.
Now, I'm not, I don't think everyone will agree with me, and that's perfectly fine. But I truly believe that if you want to differentiate yourself through all the changes that are going on in corporate dentistry, clinical dentistry, all the way through right now, the only thing that nobody can take away from you is right up here. Yeah. Would you agree with me?
100%.
Like if you're thinking and you continue to think, nobody can take away that part from you. So I think in order to differentiate yourself from just the big track practices and the volume practices is to use your diagnostic skills. Okay. And so when young dentists come to me and they go, hey, I want to be busy and I want to be more productive, well, what course do I take next? Well, look, if you go and take a course for composites, I can say with you as a Canadian, and so if you take a direct restorative course, or you take a course on how to prep a tooth properly, or you take, let's say, some simple endo courses to learn how to access and clean and shape. I'm not talking about the big complicated ones. There you can probably take those courses over a few days or a weekend and at least learn how to improve some of your basic restorative skills so that you can implement it right away. But if you're just going to go take a weekend course on implants or a weekend course on ortho or a weekend course on taking out wisdom teeth, I just think that's the wrong way to do it. It's a continual thing, and that's a more complicated discipline in all of those. Do you understand what I mean?
Yeah, for sure.
And so if you want to get a bang for your buck right off the bat, I tell some of the younger dentists, fine, if you want to do that, take a simple endo course to learn how to clean and shape and access, and start with small, simple endos, and then get a really good mentor who's going to help you, and refer the other stuff out until you can really do it well. Learn how to do composites really well. Learn how to do some basic crown and bridge really well. Don't dive in and just take a weekend course on veneers and all of a sudden you're cutting people's teeth down, but you're not thinking. So that's one. Number two, exactly what you hit on. You found a mentor right there. So I would say, if you're going to do anything, I would, beyond that, if you want a quick thing, those are the three things. Those are the little things. I would learn how to become a really good diagnostician, how to diagnose and treat and plan. Yeah. And the only way you can do that is your way, either having a great mentor who's going to sit with you and force you to take pictures, force you to take photos and x-rays and casts, and actually talk to you about the case and ask, why do you think these things failed? How do you think we can create success? Otherwise, the only other way you can do that, in my opinion, is to take a structured curriculum. Yeah. And you're either going to go to grad school, or you're going to go to a Coy Center, you're going to go to a Spear Center, you're going to go to a Pankey Dawson, something like that. And I don't know what there is in Australia.
Yeah, I need to find out, because I don't think there is like a proper continuum like that.
Right. And so if you do that, you're going to learn things, because they go in a sequence where you're learning how to diagnose. You learn about occlusion. You learn about restorative and biomechanics. You learn about implants. You learn about everything, and you piece it together like grad school at your pace. Yeah. Okay. And if you do that, all of a sudden you start using your mind, and you see things that you're not going to see like 6 months ago. Because you're going to look and you're going to go, man, I know there's other issues. When you just got out 6 months out of school, you look and go like, I don't know. I mean, it's broken. Let's fix it. And you know that all you're thinking about is, am I near the pulp? If I'm not, do I do it direct or indirect? You're not thinking about why it broke. You're not thinking about what happens 20 years from now when it breaks for the fourth time. You're not thinking about that. Absolutely. Because it never occurred to you. And you're not asking the why, you're just going, well, the how. And I'm just going to do these two. And if it breaks again and it breaks a third time, then you might ask your senior dentist, like, what the hell happened? Like, I don't know why it keeps breaking. Yeah. Right. And so that's where I think as soon as you do that, you see things completely different. And everyone has to have that aha moment. But if you can gear yourself towards that and want to do that, I think you're better off. I just absolutely do. And it took me 7 years to get to that point.
Yeah. And I think you get more enjoyment out of those bigger cases. It was interesting. I was listening to like another, it's like an investment podcast for like physicians mostly. And they're talking about what's changing in the US with physicians is because of the reimbursement fees are going so much lower, which I guess is happening with dentistry as well with insurance. And not so much as in the US, luckily. I think we're a little bit better off still in that sense, them dictating our fees. But people are starting, you pay for time, like you pay for the dentist or the doctor to actually sit for an hour with you and take the time to and comprehensively diagnose, versus like a 15-minute in and out exam where you can just diagnose, okay, a couple of cavities there, a couple of chipped teeth there, and just fix it up. Yeah. You don't get that comprehensive picture. And I think that's going to be like the delineating factor. Like eventually some people want to invest the money into their health, and they're going to pay for something to sit down with yourself who has, years of experience, who's gone through the continuum, who's done all the training to get a comprehensive treatment plan for their oral health, versus going down the road to a corporate chain where it's just, okay, let's fix that one, let's fix that one, let's fix that one. And then you're off. Yeah. So I think that's going to be an interesting change in the profession for the next few years.
Yeah, it will. And I don't think it's going to be as much as many people doing that as I would like to see. Mm-hmm. But I truly believe that those are the practices that can negotiate through all those changes and find themselves a way to compete with the corporate dental world. Yeah. I do believe that that's the way.
That's the way to go.
Yeah.
So in terms of all the CE done, and I know continuums are going to be the answer most likely, but what's been the biggest ROI in terms of like the procedures or concepts that you've learned so far from all the courses you've taken?
Oh man, I would say right now there were two big ones. One was University of Minnesota in Buffalo, where I did a postgrad aesthetic program. I mean, it's still going on. I think they're just finished their 21st year. It was a continuum that if you did it all faithfully, you could probably finish in about 3 to 4 years.
Yeah.
I did it over a longer period of time, but the first year was about 100 hours. It was over 4 weekends, and it wasn't just aesthetics. They talked about occlusion, they talked about materials, they talked about surgery, they talked about partials, and you had different components. And then the second year was all clinical. And there was 4 weekends where you do treatment planning. You actually treated patients in the clinic, and you sat if you were in grad school, and all the 15, 16 dentists would sit and share their cases and put up all their records, and you would sit and talk about the cases before you went in. And so you learn all of that. And then the other ones were all modular, where you'd end up doing, a weekend of just learning partial dentures, or a weekend of doing implants, or a weekend of doing, just restorative and veneers. And so I learned that. So that was one that all of a sudden just took me to a different level. The next one, not as much the MISH, and it can, but I don't do a ton of implant surgery, but I learned so much about diagnosing implants. But the next one was the Coy Center. And John, I mean, I finished his whole continuum like 5 years ago, 2013. I mean, it was by far the best educational experience that I've had outside of dental school. It's like going to grad school. It's evidence-based, it's current, and he taught me to be a really great diagnostician or good diagnostician. I think he's great and fantastic. And now I'm actually been taking some of SPEAR courses as well now, just to get some variety and do some other things. So, but bang for the buck, definitely one of those continuums, and I would highly recommend. I'm a huge fan of both Coyce and Spear. So,
that course that you took with Minnesota and Buffalo, is that still around? Is that still offered?
Yes, it is. I don't know for how long, because some of the people are starting to wind down and retire. So I would, if it's still available, I would definitely do it. It's not at the University of Buffalo. I was out of the last graduating class from that one in 2007. But University of Minnesota has still been going on. In fact, it was last weekend. So, I'm not sure. But if it is, it's definitely worth it.
Sure. So if you can, if you don't mind, if you can send me a link to it, if you have some sort of a website or something, I'll put it up in the show notes. If anyone's interested, they can search it out and see what they think. That's great. I think
for sure.
So many people have told me one of the best advice that I got through the podcast was, as dental students or as dentists or doctors, any professional really, we're so used to structure in school, like all the way through from since we're kids, and then we have a curriculum and we get through like high school and we go through university and then dental school, and then we graduate, and then you're kind of free. There's no structure to your learning. So like you said, you can take a wisdom tooth course one weekend, endo course the other weekend, and then you don't know how to tie everything together. So I think these programs that offer the continuum or the module-based learning is a great way to actually make sure you have a structure in place and follow through on something and learn it properly.
Yeah, absolutely. It's not inexpensive, but trust me, if you go to the right places, it's a journey. And I always use that term. It's a journey. If you want to take yourself from here to here, you need that. and it will differentiate. It's interesting because I run a Seattle study club with some friends of mine here.
Yeah.
We've been running the study club for like 15 years.
Oh, nice.
And it's and I mean, the Seattle Study Club, in my opinion, is one of the best networks in the world. There are 5 of them. There's one in there's a study club right in Melbourne.
Oh, really? What's it called?
Which I don't know. Well, the person that used to run it, I forgot the new person. It's Alex Yusupov. He's an orthodontist.
Okay, I'll look it up.
It was run by Ray Staby and Mark Petty. Yeah. And Ray retired recently, and Alex is the orthodontist in Melbourne, and he runs the study club now. And I mean, that network is one of the best networks in the world. There's 5 study clubs in Australia. There's about 260 study clubs around the world. Majority of them are in North America and in the US. And then there's some now in Europe and even in India and China.
That's amazing.
But the way the club runs is that you have, typically it's a specialist. I'm one of the rare GPs that's kind of directs it, but there's a kind of an advisory board of specialists and restorative docs, and then you'll have your other dentists, and you learn about diagnosing and treatment planning in an interdisciplinary fashion. So it's not a club about endo or implants or, veneers. It's looking at everything.
Yeah.
And so you meet about 9-10 times a year, and you treatment plan. When you treatment plan, you put cases up with all the records, and you do all of that kind of stuff.
That's great. Yeah, I'll definitely look into that. That'd be great to get involved with that. Absolutely. Yeah. Perfect. So next thing I want to kind of touch on with you was, I know you do a lot of lecturing and a lot of teaching. Talk to me a little bit about that journey, because that's something I know, for me personally, I know I don't have much to teach yet, but I think as I get more experience and as I kind of establish like what my kind of area will be, that's something that I would love to do, because I really enjoy the teaching aspect of it. So you can just talk to me a little bit about that. Like how that's progressed in your career, that'd be great.
So what happened was I've been lecturing for probably about 15 years, and I don't know, I got started. I don't know how I got started. I just I did a local program, and then I had a couple. There's a dentist in Montreal, Elliot Mechanic. He's a Canadian educator and really good dentist, and he kind of got me into programs at some conferences at the Pacific Dental and a few others, and next thing you know, I just started. That helped, and then I started working with some dental companies as well, just evaluating products, and next thing you know, I'm doing some stuff with them. So that's kind of how it got started. There are a few larger meetings like Pacific Dental Conference in Vancouver, and the California Dental Association, Chicago Midwinter, some of the Texas meetings, where they actually have a new speaker series now, where if you're interested, you can actually put in an abstract to do like a 50-minute or 1-hour talk. And if you get selected, you can do that. And then what happens in some of those meetings, a lot of those major meetings, they'll have scouts, like literally meeting scouts, and they'll be from different cities and different meetings from provinces and cities, and they'll come and they'll go, "Hey, I saw you at such and such, and I listened to a few minutes of your lecture, and you really sounded good. Would you be interested in coming and speaking at our meeting?" And that sort of thing.
That's great.
So a lot of that started that way, and putting in time, and now it's just snowballed to the point where I'm just doing a lot, and it's been fun. It's been very busy though. And now I speak to a lot of study clubs, which I love, because they're really high caliber. A lot of specialists and dentists who are just really driven to excel. And so it challenges me, because I have to have a lot of not just anecdotal information. I've got to have evidence and literature to support what I'm talking about. Which is nice, because it keeps my dentistry and my skill level higher.
For sure. Then what's your area of interest in your lectures that you present?
Well, for the longest time, it was like everyday restorative, and I still do a fair amount of that, where I'm talking about bonding, adhesion, material selection, preps, and how to pick the right ceramics to have a have good success, and even implant restorative. So I focused a lot on that.
Yeah.
Over the last couple of years, I've been asked a lot, like more and more now, to talk about digital dentistry and digital workflow, and how do you bring that into practice? How do you incorporate it? How do you utilize it? How do you train your staff so that you can implement it and have it successful? So those are the two big things that I do a lot of lecturing on.
Great.
And then the third is treatment planning, where I'll do,
that's big.
We'll have some study clubs where I'll talk a little bit about restorative, and then we'll throw a bunch of cases up, and we'll actually sit as a group and we'll diagnose and treatment plan them and tear them apart.
Yeah. And so you talked about technology in the office. What are you using mostly right now in terms of your workflow, and how's it impacted like the way you're doing dentistry?
Oh man, I've been digital for about over 9 years. So I've used all sorts of different scanners, but we probably are at least 85% digital.
Nice.
And so that's what I do. So I've also done chairside. I've kind of moved away from that. Just doesn't fit in my workflow anymore. But I've had an opportunity to beta test a bunch of scanners and mills and printers. But right now we scan almost everything. I have a model printer that I use to make diagnostic models and do some smile design stuff and things like that too. Yeah. So it's a lot of fun.
I think
my assistants and my staff, my entire team scans. So we scan every new patient. We scan every existing patient comprehensive exams. So it's part of their patient record. So we can communicate with the patients. We can show them all sorts of things you just can't show any other way because it's 3D.
Yeah, that's great. I think it comes through. I think following your Instagram page, you've been doing it for like 20 some odd years, and you're still having fun at the office. And I think it's pretty admirable. I think it's what most of us are hoping we'll be like in 20 some odd years, and we're still having fun at work, and we're not bored of things. So it's nice that you're open to innovation and new technologies and just trying out new things.
And I've always been, I feel like I've tried to be on the leading edge of that because I really enjoy it. Yeah. The Instagram and all that stuff, that's changed because it was guys like, my daughter, Serena, who's a dentist, and Brian Baliwas and a few others. Like they're the ones that have been, I know, and he's been great. I've known him for a while now because he actually, when my daughter before she got into UOP, she did a tour of the school, and he was the one that gave a tour and walked her through everything, and both of us. And so we connected that way. So we've known each other a while. And guys like him and yourself that have actually literally inspired me to change some of the ways that I interact with my patients. It's because of you guys. Literally, I'm no word of a lie. I'm not blowing smoke because I'm in my early 50s. Like, why would I be doing this stuff? And people look at me and they're going like, why are you doing that? And it's like, you know what? I realize now that I need to be able to connect to some of this audience, a younger group, because they're part of my practice, or I want some of them to be part of my practice. And you're going to connect in a different way. You're not going to Google. Yeah. It's just not something you do. You just go directly to Twitter or Instagram or something, right?
Yeah, we're not gonna pick up a mailer and call the flyer number on there.
No, you're not. I even asked my daughter, I go, well, will you Google something? And she goes, no, if it's on Instagram, I want to click it right away. Otherwise I'll move on. Yeah. I'm like, what? Like I'll at least look at Google on my phone. Yeah. You will use it for last resort. Yeah. Right? But that won't be your first choice.
I think I'm reading these books by Cialdini's like Principles of Persuasion. Yes. It's like the group mentality, right? Like if I go on Instagram, like a barber is a good example. Like we moved to a new area when I moved to Australia, and I was like looking for a barbershop. Right. And it's one thing to like look at Google reviews, but I went on Instagram and I searched barber in my local area, and I see the pictures and people there. I'm like, okay, this one seems busy. Like, and that's how I picked it. So I think it's definitely a way of the future.
Well, awesome. I got to tell you, I found my new lab technician in Toronto that way.
Yeah. Oh,
I'm looking, and all of a sudden I see the work, and I of a couple of dentists, and I start looking at the lab work, and it's like, oh my God. Mm-hmm. And I just called them through social media.
That's
And
great.
man, we have a great working relationship, but he does amazing work. Really. Yeah.
We have
It's funny.
yeah, one of the nurses I work with, she's a university student doing marketing. And last week I was like, "Oh, do you guys learn much about like social media marketing and stuff?" She's like, "What other marketing is there?" I was like, "The university teaching has changed as well." So
I know, it's so funny.
yeah. So the last thing I want to kind of touch on before we just jump into the quick kind of like rapid fire thing I do to wrap up the episode is obviously you mentioned your daughter's a newly graduate dentist. I think she's in Chicago. You said, right? She's working.
She is, and you know what? She just got into perio last week.
Oh no way!
Yeah,
That's great. Awesome.
Yeah.
Where is that going to be?
Well, it's either going to be Boston or Rutgers, which is in New Jersey, and you know, she's leaning towards New Jersey.
Awesome. So she's going to be a.
So she'll figure it out later this week, but she just found out.
That's amazing.
And I tell you, I was so excited because I was at a meeting and I got a text and she says I got in, and so I was sitting next to my friend and I actually teared up.
Oh, that's amazing.
And he's like, "Are you okay?" And I go, "She just got into grad school." And I walked out. I called her. She's like, "You're crying," and I go, "Yeah, I am." I said, "This is pretty exciting."
Yeah, that's great.
So yeah.
Yeah. So what I was going to ask is, so now, I mean, now she's specializing. So I guess that would be an advice you probably gave her. So I just want to see, like, just the obviously having that she has you as a resource and a mentor, which is fantastic.
Right.
What advice did you give her when she graduated? And if you can just pass that on to the listeners. I know there's a lot of things we've already touched on a little bit, but I know specifically just like what advice you passed on to her would be great if we can hear that as well.
I just said, hey, listen, wherever you're working, try and absorb as much as you can from some of the experienced dentists. You know, take the time to ask a lot of questions and take a lot of pictures. She's not doing as much as I'd like her to do. I feel it's very important to take pictures. You're going to be your biggest critic. You should be your biggest critic, correct? Yeah. I mean, you shouldn't wait for me to look at your work. You should look at your work and go like, man, that's good, or, oh, I got to do better.
Yeah.
So take lots of pictures. Number 2, start taking some courses. So she took already in her last year of dental school, she went and took occlusion at the Coy Center.
Nice.
She's already done treatment planning and occlusion at Spear already. She's gone and taken a soft tissue grafting course from one of the top periodontists in the world, Pat Allen in Dallas.
Yeah.
She's done those things. And so she's learned, but all of them have one common theme. They teach you how to diagnose a problem. So she started doing that. So I said, look, take some of those courses and make sure that you take lots of pictures of your work to critique it, and make sure that you have the right mentor in your practice.
Yeah.
Those are the things I told her. The other thing that we're starting to do is trying to find her mentors that are slightly around her age. And there are some sharp young male and female clinicians, not all specialists, some of them are, but that you can really go to so you can relate to them.
Yeah.
Does that make sense?
Yeah, for sure. I think that's great advice.
Right? So that they're not all 70-year-old and 60-year-old people. There's nothing wrong with that, but you need a few that you can relate to as well, that are 5 to 7 years ahead of you.
Yeah. And I think it might be even
because they can relate to the fact that, hey, you're building a family, you're doing this, you're doing that, and give you some advice that way as well.
Yeah. And there might be a bit of a more of a comfort in just interacting with someone who's like similar in age and like it might be harder to relate with like a clinician.
Absolutely. So there's nothing wrong with that.
Yeah. Perfect. Thank you so much. It's been a great, there's a lot of points that I wanted to touch on and we went through all of that, which is great. So I like to wrap these things up with a bit of a rapid fire, just to lighten things up. So what's the first question is, what's your favorite pizza topping?
Oh, mushroom.
Mushroom. Okay.
I love mushroom, man. Yeah.
And what's your,
I can have balls.
Yeah. What's your favorite tooth to work on?
Oh, favorite tooth. Oh, man. I would say central. I mean, if you can make it look great, patients are going to be happy. Yeah.
Great. And what's the one procedure you love doing?
I really love to do a smile makeover, like just getting the patient, whether it's direct or indirect, especially indirect, just the right preps, getting the right ceramics, and and then just giving the patient that smile again and that confidence again. That just charges me up when they just tear up and I love that. I love that.
And what's the one procedure that makes you question why you're doing dentistry?
Oh, root canals. It just makes me cringe. It gives me anxiety. I just don't enjoy it at all.
Yeah.
A couple of my best friends one of my best friends is an endodontist, and we laugh about it all the time. But I just, no, if I can do an opening to get someone out of pain, like, I'm super excited because I just don't enjoy it.
Yeah. I'm getting there too. I think I'm too early in the game to completely give it up. But every time I'm like midway through, I'm like, why am I doing this? Like, it's just so inefficient.
Yeah. I got you.
Finally, what is your favorite Instagram account to follow?
Oh, it still has to be Bollywood, like SF Down, or I don't know. There's just and he's really ramped it up even more in the last few months. But what I like about it is that he's accountable for good quality work, and I know that he does that. He makes people accountable, but he also finds humor in everything, and so he creates that levity that we need in our in dentistry. Yeah. He's got a great balance of both of those.
He's pretty prolific. Like, he posts a lot. It's just creates so much content. It's hard to imagine how he finds the time to actually do all that. I'm struggling with that.
No, absolutely. Hey, so am I. Tell me about it. And but no, I think that's one of the more enjoyable ones. It's just really good. There's lots of great restorative ones and surgical ones as well, but that's the one I look forward to when something comes up. It's like, okay, and you have a little laugh and you move on. Yeah.
Awesome.
No, it's
Thanks
great.
a lot. We kept you for an hour. I know you're a busy guy, and it's late at night.
No, it was a pleasure.
What's your prospects for the Jets this year? Do you think they have much chance against?
I got to tell you, man. Oh man, that's those are fighting words. Man.
We're off to a good start.
I just honestly, it doesn't matter what division you're in. Like, I think right now, I mean, arguably the Central Division is the hardest one. I think as long as the Jets can, compete well like last year and get in the playoffs, I'm not worried whether they finish first or seventh or whatever. But we're going to be competitive. But there's a lot of great teams. We're way overdue to have a Canadian team win a Stanley Cup.
That'd be unbelievable. Yeah.
Yeah, and I would love it to be the Jets, but we need a Canadian team.
I can't imagine what happens in Toronto if we lose in the finals. I'm already standard Toronto fan. I'm already like, oh man, we're gonna lose in the finals. It's gonna be heartbreaking.
Oh man, I don't know. Right now, listen, they've got a great team, and they're gonna be tough. They're gonna be a tough team, and you just never know. You never know if you're coming into Canada next time or if you're coming over the winter. Let me know, because you're welcome to come, and we have, my buddy and I have season tickets. You're welcome to come to and enjoy a Jets game. Yeah,
that'd be great. I came to Winnipeg once. I think it was like last year, a year and a half ago. So it's a cool city. It's a nice and small, so you can kind of get around everywhere. And
you can.
Yeah, it's a bit cold, but maybe in the summertime it'll be nice.
Summertime is super hot, and the winter.
Yeah, I've gone a bit soft living in Australia now, so I can't handle it too much.
I don't blame you. I've been to Melbourne. It's a beautiful city. Yeah. I love it. I really, really love it. Yeah. So,
awesome. Thanks a lot. Thanks again for coming on. Hopefully we'll chat again in the future. We'll do another follow-up episode in a little bit.
Yeah, no, that'd be great. I really enjoy what you're doing.